So again, we're using, we're doing the chest drive first. We're going to make sure that we find a really clean cut. We're good to go. Let me check this. Okay. So as we know, clavicles do not cross the body directly horizontal. They do drop. So as we work into the midline, please follow underneath the clavicle and not across and superior to the maneuvering. Not good. Okay, so I'm going to just firstly do my stretch to start with without Nick moving his head. I just want to find out, and I'm going to stretch all the way through, so just, is that alright? Is that okay? Yep. So first barrier, I'm just finding that there, hold it for 10 seconds, off. Now remember, I'm doing a fascial stretch, and as I mentioned, the moment you start pressing down, there's a chance that you might mark people. This is increasing the pressure by pressing down slightly. Is that alright? And you're welcome to ask questions as we move along. There's no background music or anything. And hold. So just again, just checking my placement.
So the movement is only towards the feet? There's no sideways, only just down?
So I'm just following, I'm going directly, is it perpendicular? Can you say that? With the clavicle. So I'm heading this way, not straight down here.
So did you go directly onto the sternum?
Yes.
Yeah, okay.
Yeah.
So directly onto the manoeuvring?
Yes. Is that alright?
Mm-hmm.
So we just do this once, and then we're going to get your head to move around. And generally speaking, with the movement of the head, I try not to direct the patient or the client too much. I want them to actually find that restriction, so I'll guide them a little bit, but it's good to let them kind of feel it, you know what I mean? So there's your stretch, so you want to try and move your head. You're an expert at this because Jane's been doing it, so you know exactly. So we're feeling that stretch all the way through here. Come back to centre, and then I release. So that's the order in which you want to do it, so that the person feels really comfortable. First barrier, second barrier, hold for 10. You can see that stretching through here. And back to centre, and I'll release. Yep. And release. Okay. So the central one is a bit tricky in that it's pretty hard to get your head straight back. If you want to drop the head off the table, by all means, but don't. Okay. Is that alright?
Mm-hmm.
Come back to center.
Extending and rotating.
Sorry?
For the client, you're extending and rotating.
Am I extending rotate?
Your client is extending and rotating. Now.
Yeah.
Yeah.
Yeah. Just finish this off. Hang on a sec, let me get the first barrier. There, now move. That's it. Back to centre. Release. Yep. That's good. Centre. Last one. Okay. Yep. Back to centre. Perfect.
And
All right.
how does this compare to a physical stretch?
To a physical stretch?
Yeah.
What sort of physical stretch?
Well, you know, you run through your stretches for your various neck muscles. So instead of us actually putting pressure on there, we're actually using the cup. So how does it compare to that?
Well, you're not doing any contraction through the neck, so it's really just a movement stretch. You'll feel it, so you'll be able to compare.
Yeah.
But again, we're trying to treat fascially, so the object is really to try and get that stretch that covers up onto the face. That's the thing for some people who are really tight through there. So always think fascially with it as well. Okay, so then product on, and then we just work this whole pec area. Now, as far as draping is concerned, there's a couple of ways we can do it for women. Pretend you're a woman, Nick. So we can dip in like that because we do want to get into the sternum. The other way is that you can use tea towels, sort of that size tea towels, and you can tuck one and you put it into a triangle. So you tuck in, and it comes down there, it tucks in, tucks in, tucks in. So that means that that leaves that area open as well, which is a really good way of doing it. It also means that if you do want to get into that wide area that I talked about, then that can untuck and you can have the person lift up and hold. So again, the draping works really well. So just for today, we're just going to leave it as is. Just go straight into cream.
But possibly with very voluptuous ladies, you have to ask them to hold like this.
Yeah.
Because in massage, it can get really difficult to get in.
Um,
Because they're lying down, so
Yeah, exactly. And one of the things about holding breast tissue, so rather than how you actually did it, which is not as effective, if you ask them to hold it like that, it squashes and it comes up. So it's got to be like that or like that,
yeah.
because you're trying to hit the pec. So that's an important part. So. Does Jane mark you up much through here at all?
No, not really. We get some half moons as well.
Yeah.
Occasionally, but very light.
So we've done a full sequence there and we haven't marked really up at all, which is pretty cool. But as I said, don't be surprised if it does. So you're going to be aware of that. Okay. Is that alright? Now Nick's got some hair there on his chest, so I'm just going to keep the pump on for a minute. Just see how we keep the seal. Is that still alright? Cool. So just hitting up on as much tissue as you can.